Yeah. So I have a question here. So like someone like me, I'm in my kind of late 20s at this point, and I'm not really sure of my family history. Do you think it would maybe be a good place for me to go into the doctor and kind of get these things checked, or maybe wait a few years until like my early 30s to kind of see what's going on?
Well, it's recommended that one has a lipid panel at least once every 5 years, and you should have had one at age 9 to 12 as a screening.
Mhm.
So knowing your lipid levels is important for anybody. And so you would
Mhm.
screen out whether you had this LDL over 190, which would be a very high risk. And
Mhm.
also, like I mentioned, the lipoprotein A. You should ask your doctor for LP little a level, lipoprotein small a, because it's recommended once in a lifetime. And if that's there, then you'll know at age
Yeah.
28, oh, I got to really start working at least on lifestyle, maybe
Yeah.
medications if it's very high. And there's nothing wrong with being on medications at a young age. I think it's not been done over time, but we should be looking at 30-year risk instead of 10-year risk, which most of our calculators are 10-year risk, which
Yeah.
is really not going to stop the disease early enough. As mentioned, cardiovascular disease, the number one killer, and stroke and cardiovascular disease all are hand in hand, all the same problem. So if we're going to stop the number one killer of everybody in the world, we've got to start at an earlier age to think about it
Yeah.
at least. And start with lifestyle and exercise and all that, but medications when it's very high or there's high risk.
Yeah.